Welcome to this iWorld Live event. I'm here with my good friend Robert Ang. I'm excited to talk about what we're going to talk about. It's a cool topic. Let me sort of set things up here. I had an earlier conversation, an earlier interview where we talked about the configuration of zonules in a 3D model and what actually happens during the accommodation process. And I asked about therapies and whether this model could generate any insight into ways of treating this, and my answer was, ask Robert Ang. So I'm now asking you, um, set this up for me, and then I'm very interested in, obviously I'm extremely interested in what you were doing.
So the procedure is called laser scleral microporation. So we want to do the treatment on the sclera. The theory behind this is accommodation. So when the eye accommodates, the anterior zonules relax, the anterior capsule moves forward, the posterior zonules contract, the posterior capsule moves backward. So this forward and backward movement of the capsule elongates the lens. But when we grow old, one of the theories is the zonules don't move as much. And why is this? Maybe the sclera becomes more rigid, not allowing this movement. So the UBM study says that something's happening. So the theory behind the laser microporation is to make micropores on the sclera, make sort of little holes using an erbium YAG laser, and these holes will decross-link or soften the sclera at the four quadrants. So superior nasal, inferior nasal, superior temporal, inferior temporal, avoiding the major blood vessels. And by softening this, you allow the zonules to move again to restore natural accommodation. So our what the treatment wants to do is not touch the conventional areas that we do presbyopia treatment, which is the cornea or the natural lens. We're not going to touch those. Therefore, this is ideal for patients who are emetropic, people who have no far vision problems. So there's no refractive shift. So that's what we want to work on. And we have data now on primate eyes, so monkey eyes. We started with monkey eyes, and this is what I'm going to talk about with you.
Oh, so really, really, really interesting. Before we talk about the primate studies, walk me through a procedure.
Okay, so the laser, of course, there are like the first generation laser, and we're working on the next generation laser. So the first generation laser, it's a handheld device attached to a module, and we have this device that erbium YAG laser. We hold it up, put a speculum, anesthetic. We hold it on top of the sclera near the limbus, so there's some markers, and then the laser fires for 10 seconds. We do one quadrant for each eye. And then we finish, we put collagen gel so that it lessens inflammation and lessens pain. And that's it.
So you were treating through cons. You're not doing
No dissection
peritony
of con.
for it. Yeah.
But in we've of course we've done preliminary human eyes, but in the monkey eyes, because the conj is thicker, we had to remove the conj. Whereas in the humans, we do transconjunctival.
So tell me about these primate treatments. Which primate did you
It's
work
a
with?
macaque primate, so it's a monkey eye. Uh, the studies were done in Singapore. Dr. Job Mehta was the one who we were collaborating with him in doing this. And basically, what we wanted to do is number one, test clinically with the eye trace what happens before and after treatment, and also histologically. So we would sacrifice the monkey at 1 month, 6 months, and we wanted to find out what the treatment does to the sclera, inflammation, wound healing, and all that, because we want to know if this is being reversed or regressed over time and what happened. So those are the two primary aspects, the clinical and the histopath or laboratory work that's been done.
Well, don't leave me hanging.
Okay.
What did you
So
find?
first, we mounted the monkey on eye tray. So as you can see, sometimes it was difficult, sometimes it was easy, and we wanted the eye trays can take accommodation extended depth of focus measurement. So there are two humps. One is the true accommodation hump, and one is the pseudo accommodation hump. And we found out that. the monkey eyes who are at least like 7 months old or older, um, the true accommodation changed by about 5 diopters, and the pseudo accommodation by about 2 diopters. So about 7 to 8 diopter change in extended depth of field. So that's we were surprised at that much, but this monkey, maybe humans will react something
Yeah,
else.
it's
So
a tremendous number. Yeah.
yes. So, but first we saw a clinical effect, which is measurable by one of the machines that we use actually on humans. So, after that, we were sacrificing the monkey. So, first is we wanted to see inflammation because any treatment causes inflammation. And at 1 month, all the inflammatory markers were gone. So, we put steroid drops and we had this collagen gel. So, it helps with wound healing. The second thing is um, the pores, which go around 80% depth to the sclera, we wanted to know if the fibroblasts grow back, and these fibroblasts will they make the sclera stiff again. And so far, the fibroblasts that grow are not the myofibroblasts that cause stiffening. So the histopath shows that they're just wound healing, regular wound healing. So regression doesn't seem to be a problem because if they're myofibroblasts, then it will stiffen again. So far, as we sacrifice the monkeys later on 9 months, there weren't any of these fibroblasts that will be harmful and will stiffen again the pores. So clinically, we saw eye trace data, which tells us something's happening beneficial in terms of accommodation, wound healing, inflammation is down, which is good. It resolves, and there's no regression effect because the myofibroblasts do not grow back into the pores.
Oh, really fascinating. It, does the technology look like it works the way that you intended it to work?
I yes. The good thing is, uh, we we wanted to know if we can soften the sclera, but there's no effect because we are we are doing something in one part of the eye, but we're indirectly making the effect on the other part, which is the inside. And as you know, there's no way it's an indirect measure. And so far, we see an effect, which is very encouraging for us. That's why we want to move forward and do more early human trials next. So one step at a time, but we need to know also the histopath. You know, we cannot.
Sure.
We need to know certain things in the eye for safety.
And have you begun human trials?
We had some training on some humans in Southeast Asia, but not a lot. Just to test the laser and its effect, and we also see some accommodation. We also use the eye trace, but of course we don't have the wound healing and the inflammation studies on a human. We needed the primate eyes to provide us that as a necessary backbone for safety reasons.
This is really, really, really fascinating stuff. You know, to some extent, there's a history of doing scleral weakening surgery.
Yes.
The results were disappointing in the past.
Yes, so there were some sclera procedures where it's more invasive. You had to put something in the sclera, it's bulky. This one, first, it's not as invasive as the other treatments, which is good. Number two is we have a machine that has some depth control, so we know what we're causing, and we want to do the homework of checking the histopath results because who knows what we might be causing. And so far, safety is a primary concern, and because it's established that we're not causing something, we can move forward.
Now, granted, we're a long way. It sounds like
Yes.
from commercialization
Yes.
of a product, but I mean, just if you had to guess, as you have to, because I'm about to ask you, uh, how long that time frame is going to be before we may have something we may be able to use clinically.
I think when if we time the timelines for our study is we probably will begin something near the end of the year for humans. So my approximation is 2 years, not only for safety but for effect because people are gonna ask, does this treatment regress? Right? I mean, how much treatment do you do? How much effect we get? And does this last 6 months, 1 year, 2 years, more than that? So all of those factor into longer follow-ups. But
This
we're kind of excited. Very
Yeah, no,
excited.
this is fascinating stuff. I mean, I don't have to tell you, more than justified in being excited about this. I mean, this is really, really cool. Um, I regret only that you're not closer to the monkeys because I bet that's interesting. John's
Yes,
going to have fun with that.
correct.
Um, so I want to thank you for bringing this really, really cool topic to us. You always bring cool topics, but this one's it's really, really cool topic. For sharing it with us, for explaining how it works. I learned a lot. I'm sure that you learned a lot watching this. A live conversation with Robert. I don't have to tell you, he's an extremely bright guy, well worth my time. I know well worth your time, which is why you're immediately going to, at the end of this video, go and tell your friends to subscribe to iWorld Live. It's cool because of people like Robert.
Thank you. Thank you, and stay tuned for more results.